Hello friends, welcome back to the channel. I'm Dr. Aman and today I'm gonna give a highlight about the medical training initiative program for the ENT surgeons in the UK. So a disclaimer that I do not represent the GMC, NHS or any of the Royal Colleges in the UK. This video is solely for the purpose of awareness on the sponsorship pathways for the international graduates who want to come to the UK and practice medicine. And if you wish further information about getting an MTI post in the ENT, please contact the email address that's given below. Alright, so if you guys have not seen my earlier videos, so I'll just start from the basics that what is MTI. So MTI basically stands for Medical Training Initiative. So this is a scheme for overseas doctors like us to come to the UK, work here, get sponsored by the GMC itself. So we do not give any plab, or if you have parts of the membership exams of your Royal Colleges of Surgeons, and you can just come here if you fulfill the criterias, of course, and start working, gain your competencies, gain experience, make some money, and go back to your countries. So what's the eligibility for you to apply for the MTI program at the ENT UK? So you should have no rights of residence in the UK, European Union Association, or the economic zones, or Switzerland. So basically, if you are, citizen of lower middle, or lower income countries, for instance, Southeast Asian countries, African countries, South American countries, you are mostly eligible for the MTI scheme. So what other eligibilities? So you have to fulfill the criteria of the GMC. So it's very simple that you should be at least working like past, if you talk about the past 5 years, you should be currently employed or in training for the past 3 years, and the last 12 months should have absolutely no gaps. Please take like a note that clinical attachments or observerships do not count. So ideally, if you're applying for the MTI via ENT, you must have something as a postgraduate qualification. So if you're from India, Southeast Asia, master's degree, preferably like maybe MS or DNB if you're from India, if you're from Pakistan, FCPS, various other countries, if you have done something in the field of ENT as a postgraduate qualification, then yes, you will be definitely eligible. Before we even talk about the other things, there's a very stringent 12-month rule. So this states that currently, if you're working somewhere or you are in training somewhere, the last 12 months should have no gap. If you have a gap of less than 5 weeks with a very strong reason, then it's acceptable. For instance, there's some bereavement in the family, or you have some family healthcare issues, you are pregnant, deaths in family and all, then they may be considered. But the best practice, to be honest, like for you to have a sure go, is the last 12 months please don't have a single day without an explanation off. So that's the best way ideally to avoid their loopholes. And as I said earlier, observation ships are not considered here. So if you have just completed your internship back in India or Pakistan or Southeast Asian countries, African countries, sorry, this does not count. Ideally, as I said, you should have some evidence of postgraduate qualification. So what are the other documents that you need if you're fulfilling the basic criteria? So first of all, there is an application form in the website of MTI UK. So basically it's a like general form with all the details and everything. But you must also have a logbook of procedures, because this form basically would ask you that how many procedures have you done independently, how many have you assisted. Say for instance, if you are a ENT surgeon, how many tonsillectomies have you done, how many tracheostomies have you done, foreign body and all. So like the master that you are, so you must have competency signed by the institute that you've been working, your supervisors, anyone. So there's a standard of Edinburgh logbook that we call, so you have to get that logbook signed as well. You must have a CV. See, most of the CVs that we, people from Southeast Asia usually make are very, very vague. UK people are very, very particular about getting a very strong CV. What makes a CV strong? See, publications, conferences, audits, short courses, and teachings if you have done any. So you must have a proof of these. It's just not like if you've written on a CV and you haven't done it. Once they ask you for a proof, that reflects very bad on you. So if you have done some teachings, have some proof for it. If you've attended conferences, attended short courses, have basic evidences, the certificates or evaluations that you've got along with you. You must possess a passport. Yes, passport is very important because without that you can also not write the English competency test. You must have 2 references. See, now references can be a little tricky because your mentors or the person whom you are referring as your referees may not be having the membership or the fellowship of Royal College of Surgeons. But if you have a mentor who has fellowship or the membership of Royal College of Surgeons, definitely yes, that's a big advantage. So in case like you don't have a current mentor who is like a member of fellow, but the previous ones who are there, please have a chat with them that you're applying for such and such post, and are they okay for them to be given as your referees. What happens is, like, most of the times we would think, okay, let's put his name, what's going to happen. But if you're successful in your current applications, and while the GMC or your Royal College wants a reference form to be filled and the referees do not know, very bad reflection again. So you may get, what to say, backlogged because your referee doesn't want to do stuff for you. Other than that, you must have an English competency, as in you must have a IELTS or a O8 with the minimum score. The minimum scores I've discussed in previous videos as well. So if you're writing IELTS, it is basically reading, writing, listening and speaking minimum 7 and overall 7.5. With O8 it should be at least B. So what training do you receive? So everything's gone good. Congratulations, your applications have gone through, and now you're in the process of getting the interviews or places assigned to you. But do you really think, is it worth it? Because you may have so many thinking about, like, oh, should I go this far, like how's the country gonna be, like how it will be perceiving. So what is the training that you receive is prime important here, because you would still be getting trained under a supervisory environment here, preferably an NHS consultant who is already a fellow, a member of the Royal College of Surgeons. So yes, he will definitely facilitate you getting your exams done, at least show you some guidance or the pathway and all. Plus you would get paid. See, it's not that you are paying to come, like the only expenses you would be paying is your visa charges, your GMC fees, your English exams, some exam like some fee to your Royal College, local colleges for the EPIC verification and all. But you are not paying a very, very hefty sum still. 1 lakh rupees, Indian rupees, I would say just £1,000 or something, and all your expenses would be covered, and you would be at least getting paid 38,000 to 48,000 pounds per annum. Without your added incentives or on calls. So if you are getting appointed at a level of core trainee 1 or specialist trainee 1, you would be at least getting around 38,000 pounds take home, if you say, after the deductions and the pensions and everything. If you opt out of pension, it would be still around 3,200 pounds. If you opt in for pension, it would be around 2,900 pounds, something like this. And if you're lucky enough to get into a ST3 or a specialist registrar post, then you may expect a salary of 48,000 pounds, 48 to 50,000 pounds. So the take home without the added incentives, if you are still opting out of pension, is well gonna be above 4,500, 600 pounds, something like this. So yes, you would be getting paid. So what is the cost that you need to incur if you want a sponsorship from the ENT UK? None. Yes. So ENT UK is not going to charge you a single penny for issuing the sponsorship for the GMC registration. So it's good news. Yes, it is. So how do you apply? Okay, so now watching my videos up to this and you think, okay, I can give it a try. So there are various websites that I've you showed on the screen. So the best website, to be honest, is the ENT UK website itself. It is very self explanatory. There are so many questions that you may have. It's very well explained on the website. The website has the MTI application form, it has the cost, and person who can be contacted and everything. For getting the visa and sponsorship, other details, the Academy of Royal College of Medical Colleges, because the visa would be getting done only and only if you have the sponsorship, the certificate of sponsorship, which is being given by the AOMRC. But as I said, the sponsorship for the GMC would be given by the ENT UK. Plus, you can always, go handy checking the GMC website for other loopholes or, other informations. So I think I have given a brief idea about the MTI program for the ENT surgeons in the UK. So if you have further doubts, I've given the email ID in the first slides. In the disclaimer, you can mail the person, and just come to the UK. It's definitely gonna be a different learning curve for you, because back in your countries there's a different patient, the overall cases that you see and everything. Here in the UK it's a lot different. So yes, it's good to have a decent exposure. It's good to learn the art of medicine the English people do. Of course, get through your Royal College membership or fellowship exams, and if you feel right that yes, UK is the country for me, yes, there's still a provision for you to switch your visas from tier 5 to tier 2, though it's highly not recommended, because the whole sole purpose of MTI is for you to come to the UK, get trained and go back home. So I hope this would be beneficial to you. Please spread it among your friends who are ENT surgeons and looking forward to come to the UK. And meanwhile, this is our channel, UK Dreamers. Keep supporting us. I would really appreciate if I get more subscriptions, because the whole point of making this channel is to spread the basic concept of sponsorship pathways for people who have done their post graduations, who are not fresh candidates, who've got families, and you are in your 30s thinking about whether to make a choice or not. So I'll be keep on posting. I'll be posting more videos about the family issues, the family visas, how to bring your child on and everything. Till then, keep subscribing to the channel, keep sharing our videos, keep liking the videos. Thank you so much. Cheers. Bye bye.